Welcome back to Good Things Utah. The estimated number of people living with spinal cord injuries in the United States is almost 300,000.
That's a lot. There is help, though, and hope out there. And here to talk more about both in this sponsored segment is Dr. Kevin Park. Welcome.
Thank you. Thanks for
having me. From the University of Utah Health. And let's talk about why we have more cases of spinal cord injuries here in Utah.
So here in Utah, actually number one injury reason is a motor vehicle accident. However, especially here in Utah, it will be extreme sports, more skiing injury, mountain bike injury, those kind of injuries really add up. So we tend to see more sports-related injuries here and more in Utah.
So, doctor, average age injury is 43 years old, and 78% of those new injuries are male. Why?
So average age comes from, most of the injuries actually from late teens and early 20s. However, you're right, 43 years old, where's that coming from? Is that, it comes from the older population. Now that they're living longer, and then after the injury, survival rate goes up. So they're actually living longer. So that's the reason why the age is becoming higher and higher.
Well, and we're such an outdoorsy
Absolutely.
Community and landscape, so people are outdoor more and they're doing more activities. But let's also talk about what injuries, what does it mean? The spinal cord injury means paralysis, and it could vary in a person and their accident.
You're absolutely right. So if we have to simplify, we can divide it into two different sections of a spinal cord injury. So before that, actually, if you can think of a spinal cord as a bundle of wires carrying message from brain to rest of your body. And then for complete injury, you'll have some sort of injury, accident, and imagine that bundle of wire as severed or cut completely. So there's no message coming from your brain to rest of your body to move. So patients are unable to feel or move below that level of injury. In terms of incomplete injury, it's similar. So injury happens to a certain level of a spinal cord, right? And then it's not completely severed, it's completely cut. So there's some messages flowing from head to rest of the body. However, this is like a bad cell phone reception. So you'll get, a couple words here and there. You can kind of understand, but you're not really understanding the whole conversation. So they can, move some body parts below that injury level or feel some sensation below that injury level, but there's not quite full connections flowing in and out.
Doctor, let's talk about University of Utah's Spinal Cord Injury Program. I know you have a dedicated team there, board-certified specialists that can help.
That's correct, yes. So myself with my partner, Dr. Jeffrey Rosenbluth, is leading the spinal cord injury team. Our hospital, Craig H. Neilsen, is the only spinal cord injury CARF accredited program in the state of Utah and also many surrounding states. So we take care of a lot of the patients from surrounding states. Also, our rehabilitation hospital has ranked top 50 in the nation, which I'm very proud of. And this team of spinal cord injury is not just us, actually. A physical therapist, occupational therapist, psychologist, educator, our nurses, and so many more goes together, our interdisciplinary team members in order for benefit our patients.
It takes a team. And Dr. Park, let's talk about just because you have the injury and it seems so severe, you might not be able to walk, but that doesn't mean it's a life sentence. There are so many other disciplinary things that can happen when you go through your team,
That's
such
correct.
as your speech and ventilating, weaning off of that. Talk a little bit more.
Yeah, so with high cervical injuries, there are a lot of patients, their diaphragm, meaning their lung, gets really weak. So patients come to us on a ventilator, and then we want to be able to help them wean them off of those ventilators.
And there is hope out there, everybody. Our thanks to University of Utah Health for this sponsored interview. If you'd like to know more, uofuhealth.org/spinal cord injury. Thank you to